Okay, let's paint a picture. Imagine you're looking at your dog or cat, right?
Hmm.
Maybe they've just been trying to go potty. And you see something. Well, something that just makes your stomach clench, like a tube of pinkish, maybe reddish tissue sticking out from their rear end.
Yeah, that's a really alarming sight for any pet owner.
Totally alarming. Definitely not supposed to be there. And it screams, something is seriously wrong.
Absolutely. And that visual, it's incredibly concerning. It signals an emergency, really.
Yeah.
Needs immediate vet attention.
For sure. And that condition, that thing sticking out, that's often what we call a rectal or anal prolapse.
Mm.
So for this deep dive, we've been digging into the veterinary resources, looking specifically at this issue in dogs and cats.
Right. And our goal here really is to unpack what's physically happening. What is that? But maybe more importantly, we want to get past just the scary visual and understand the why. Like, what makes an animal strain so hard that this happens? Our sources really stress this point. It's key.
It's not just about fixing the bit you see.
Exactly. It's about finding that hidden problem that's actually driving it. So we'll look at how vets figure out that underlying cause and, the different ways they approach treatment.
Yeah, because it might look like a straightforward physical problem. But what we learn from these sources is it's often this really complex sign of something else going on deep inside. Understanding that kind of helps you appreciate the challenge vets face, right?
Definitely. So let's start with the basics, just based on the sources. Rectal or anal prolapse. Essentially, it's when part of the rectum, the very end of the bowel, flips inside out and pushes through the anus. And the veterinary texts make a distinction, actually. There's incomplete or anal prolapse, that's where just the inner lining, the mucosa, pokes out.
Okay, just the surface.
Right. And then there's complete rectal prolapse, and that's the whole wall, the full thickness of the rectal wall coming out.
So incomplete is like just the very edge, and complete is that like pulling a sock completely inside out?
That's a really good way to visualize the complete one, yeah. It's literally a double layer of the rectal wall turned outwards. An incomplete prolapse might just look like a small ring, maybe like a little donut right at the opening. Sometimes you only see it when the animal is actively straining.
Yeah.
But a complete prolapse, that's usually a much bigger, more obvious sort of tubular mass of tissue.
Okay. And who gets this? Like, is it more common in certain pets?
Well, the sources say it can really happen in any age, any sex, any breed. But there is a definite higher occurrence in young animals.
Oh, interesting.
Yeah, puppies and kittens especially, particularly if they're dealing with gut parasites and really bad diarrhea. That seems to be a common link.
Young animals and parasites. Yeah, that connection jumps out. What other signs, besides the obvious tissue, might an owner see?
Well, beyond the tissue itself, the absolute key sign is tenesmus.
Tenesmus,
That's that intense, persistent straining. Like they're desperately trying to defecate, but maybe nothing's coming out or very little. The animal just feels this constant urge to push.
Tenesmus. Yeah, we've talked about that term before. So the straining itself is the actual force that causes the prolapse.
Exactly. That straining ramps up the pressure inside, and it literally pushes the rectal tissue outwards. If it's really severe or goes on for a long time, and maybe the tissues or the supporting structures aren't super strong, well, that's when the eversion happens. But here's the crucial bit, and the sources hammer this home. The prolapse itself. It's not usually the main disease. It's really a symptom of that severe tenesmus.
Okay, that makes sense. And that's where it gets really interesting, right?
Mhm.
Because the vet's job then becomes figuring out why.
Right.
Why is the animal straining so much? What's driving that tenesmus?
That is the absolute core diagnostic challenge. And the sources, they list a huge range of possibilities. Like we mentioned, probably the most common, especially in young animals, are problems in the gut causing diarrhea and straining.
Right, the parasites.
Yep. Things like roundworms, hookworms, whipworms, coccidia, giardia, they're really high on the list, or severe infections, bacterial or viral, like parvo, anything causing that level of GI upset and straining.
So checking for parasites, especially in young ones, that's got to be step one,
Yeah.
basically.
Absolutely.
What about other things, like actually in the GI tract itself?
Yeah, good question. Chronic constipation is one, or obstipation, which is even more severe blockage. Megacolon in cats, that's often mentioned too. Basically, anything that obstructs or irritates the rectum or colon can cause painful straining. Think foreign objects they swallowed, tumors, severe inflammation down there that's proctitis, or even strictures like narrowings in the bowel. Even diet can play a role sometimes, like not enough fiber.
Okay, so digestive system problems, elimination issues, That all kind of makes intuitive sense.
Hmm.
But the sources pointed to causes in totally different body systems too, didn't they? That's the part that really surprised me.
Yes. And this is such a critical point to understand. Urogenital problems, so urinary or reproductive system issues, are actually pretty significant but often unexpected causes of that straining that leads to prolapse.
Wow.
Think about things like really bad bladder inflammation, cystitis, or stones, either in the bladder or the urethra. In male dogs, prostate enlargement or infection is a big one. Even difficult birth, dystocia, in females.
So wait, how does that work? How does a bladder problem cause straining to defecate?
Well, the animal is straining intensely because of pain or obstruction in the urinary or reproductive tract, but sometimes that straining effort kind of recruits the same muscles, or the sensation gets confused. They might start straining as if to urinate or give birth, but the intensity or the duration just spills over, engaging the muscles used for defecation, and that leads to the rectal straining and potentially the prolapse.
Wow. Okay, so a bladder infection or like a prostate issue
Yeah.
that could indirectly lead all the way to a rectal prolapse. That is not a connection I would just made off the top of my head.
It really underscores how interconnected everything is, doesn't it? Straining isn't always specific to the system with the original problem. Other things the sources mention, perineal hernias, they can kind of block the end of the GI tract, certain neurological problems affecting nerve control, or even just generalized weakness. If an animal is really sick systemically, they might strain from overall discomfort.
So the diagnosis,
Mhm.
it's way more than just looking at the prolapse. It sounds like a real hunt for the root cause among this huge list of potential culprits.
Mhm.
How do vets actually start figuring it out?
Well, the very first step is always a careful look at the prolapse tissue itself. What color is it? How long has it been out? Does it look healthy or is it damaged, maybe dark or dry? But a really critical early step, the sources emphasize this, is telling it apart from something that can look almost identical, a prolapsed intussusception.
Okay, intussusception. What's that exactly?
That's when one part of the intestine, basically telescopes, slides inside the part just ahead of it, like a tube sliding into another tube. And sometimes that telescope section can travel all the way down the GI tract and actually stick out the anus. And visually, externally, it can look incredibly similar to a rectal prolapse.
Yikes. Okay, so how do you tell the difference if they look so much alike from the outside?
This is where a really important diagnostic step comes in, described in the sources. It involves a digital rectal exam using a finger and sometimes a blunt probe test. With a true rectal prolapse, if you try to gently pass a probe or your finger between the mass that's sticking out and the anal opening itself, it should only go in a little way, maybe, 1 or 2 centimeters. Because the tissue is continuous, it's part of the anal wall folding out.
Right, it's attached right there.
Exactly. But with a prolapsed intussusception, because the outer layer you're touching is actually bowel that has slid down from further up, the probe can usually pass much deeper, like 5-6 centimeters, sometimes more, into that space, that lumen between the inner and outer layers of bowel.
Right.
Ultrasound can also be really helpful here. It can often show that characteristic bullseye or layered look of the telescoped bowel, maybe even still inside the abdomen.
That probe test sounds like a simple but incredibly important way to figure out what is actually sticking out.
Mhm.
Okay, so once they know, yep, this is a rectal prolapse, what tests help find that underlying cause? The why?
Well, like we talked about, a fecal exam is absolutely essential. Got to check for those parasites, especially in young animals. Blood work is pretty standard, looking for signs of systemic illness, inflammation, dehydration, that sort of thing. If they suspect a urinary or reproductive issue based on the exam or history, then a urinalysis is key. Imaging, like x-rays or ultrasound of the abdomen, can be super useful. They can help spot foreign objects, bladder stones, kidney stones, check out the prostate, look for tumors or masses.
Right.
And a really thorough digital rectal exam, feeling inside, lets the vet check for any masses or strictures or hernias right there in the pelvic canal. And sometimes, for cases that keep coming back and the cause is really elusive, they might need to look inside with a scope, a colonoscopy, to see the lining directly and maybe take biopsies.
That is a seriously comprehensive workup. It really hammers home that the thing you see, the prolapse, is just the tip of the iceberg. You've got to investigate way deeper inside. So, okay, once they have a better idea of the why, how do they actually treat it?
The sources are crystal clear on this. Treating the underlying cause is number one, absolutely paramount. If you don't fix that, the prolapse is just very, very likely to happen again.
Makes sense.
As for the prolapsed tissue itself, the immediate steps really depend on its condition. Is it viable? Does it look pink and healthy? Or is it looking dark, dried out, maybe obviously damaged?
What if it looks okay? Still healthy.
If the tissue seems viable and it hasn't been prolapsed for too long, the first aim is usually manual reduction, basically putting it back in. The area gets cleaned really well, and the sources mention using things like hyperosmotic agents, like a 50% dextrose solution, or even just plain granulated sugar.
Sugar? Really?
Yeah, applied right to the tissue for a few minutes. The idea is that the high concentration draws fluid out of the swollen edematous tissue by osmosis, shrinks it down a bit, makes it easier to gently push back inside.
Huh. Oh.
Then, with lots and lots of lubrication, they apply gentle, steady pressure to carefully push the tissue back through the anus.
That sounds tricky and probably uncomfortable for the pet. And how do you get it to stay in?
It definitely can be. Often they'll give an epidural anesthetic first.
Uh-huh.
That numbs the whole back end, reduces that straining reflex, and makes the whole reduction process much easier and less stressful for everyone involved. And then, once it's back inside, a purse string suture is very commonly placed around the anus.
A purse string, like closing the top of a pouch. What does that do?
It's basically a temporary narrowing. They put a suture in a circle around the anal opening and tighten it slightly. Not completely closed, of course.
Right. They still need to poop.
Exactly. It has to be loose enough for stool to pass. But it provides just enough of a barrier to help hold the rectum inside and stop it from immediately prolapsing again while the underlying cause is being treated and the tissue gets a chance to recover from the swelling and irritation. It's usually left in place for, say, about 3 to 7 days.
Okay. And I guess you'd want to make sure they're not straining during that time either.
Oh, absolutely critical. Stool softeners are almost always prescribed. Things like lactulose or docusate sodium, often for several weeks, even after the suture comes out, just to make sure defecation stays easy and doesn't trigger more straining. Feeding a low-residue diet can also help. Minimizes stool bulk.
Okay. But what if? What if the tissue is really badly damaged? Or what if it just keeps prolapsing again, even with the purse string?
Yeah, that happens. If the tissue just isn't viable, if it's black, necrotic, clearly dead, or if the prolapse is recurrent despite trying the purse string and treating the suspected cause, then surgery becomes necessary. This might mean a procedure called resection and anastomosis. Meaning they surgically cut out the damaged or prolapsed section of the rectum and then carefully stitch the healthy ends back together.
Right.
Or for those really persistent recurrent prolapses, especially if the underlying cause is something chronic or hard to fully control, a more permanent surgical fix is often needed. That's called a colopexy.
Colopexy, what does that involve?
It's a surgical procedure where they actually tack or suture a part of the colon, usually the descending colon, the part leading towards the rectum to the inside of the abdominal wall.
So you're anchoring it.
Exactly. It creates adhesions, scar tissue basically, that holds the colon and rectum in place more firmly. It physically prevents them from being able to slide down and prolapse out the anus again, even if some straining occurs. It adds internal structural support.
Like sewing it in place so it can't telescope out.
Precisely. It's a way to counteract those straining forces internally.
And the prognosis. I imagine that really depends heavily on why it happened in the first place.
It absolutely does. That's the biggest factor. If the underlying cause is something straightforward and easily treatable, like, say, intestinal parasites in a young puppy, and the prolapsed tissue was healthy and got put back quickly, the prognosis is generally pretty good. But if the tissue was severely damaged, needing resection, or if the underlying cause is something serious and chronic, like a tumor or severe end-stage megacolon, or if it keeps recurring despite interventions, then the prognosis becomes much more guarded.
Right.
Complications can happen too, tissue death, infection. Sometimes strictures can form where they did surgery, narrowing the passage. And in rare, severe cases, permanent nerve damage could potentially lead to fecal incontinence. And recurrence is always a risk if that root cause isn't fully identified and managed effectively.
Okay, so what's the big takeaway here for you listening? Whether you're a pet owner or just interested in animal health, it really means that seeing something as, frankly, terrifying as a rectal prolapse, it's not just one single physical problem that needs fixing. It's a critical symptom. It's a massive red flag pointing towards something much deeper going on inside your pet, something that absolutely requires a thorough investigation.
Yeah, it really highlights why your vet needs to do more than just, look at the prolapse itself, why they need to do a full physical exam, ask all those detailed questions about diet, history, potty habits, and why they often recommend tests like fecal exams, blood work, maybe imaging, even when the problem seems, well, visibly obvious. They're not just treating the part that's sticking out.
Right.
They're trying to uncover and then actually address that complex underlying issue that's causing all that intense straining, whether it's parasites or bad inflammation or maybe a urinary tract problem, or something else entirely. That's what gives the pet the best shot at long-term health and prevents it from just happening again.
It definitely gives you a whole new appreciation for that diagnostic process, doesn't it? And it raises this really compelling question, one of the sources kind of left me pondering. Think about how these conditions in what seem like totally unrelated body systems, the bladder, the prostate, how they can show up as symptoms affecting the rectum. What does that incredible interconnectedness of the body really tell us about how important it is to look at the whole animal, the whole patient, not just zeroing in on the most obvious problem spot when we approach veterinary care?